Hey sweet soul, today I'm sharing simple but powerful teachings on how to use your Kuripe properly during a Hapé or Rape ceremony. Choosing the right Kuripe, understanding the placement, and getting the right angle when you blow Hapé can make all the difference. Not just for your comfort, but for how the medicine actually moves through you and your experience with the medicine in your practice. We'll talk about how to avoid blasting Hapé down to the back of your throat, why it's not about blowing Hapé into your brain, and how to guide the Hapé gently along the nasal walls where it can really do its sacred work. So let's dive in. The long side of the Kuripe is the side that enters your nostril, and the short side is the side that goes into your mouth. You want to make sure that you have a Kuripe that has a difference in height between the two sides. If it looks more like a triangle or an equidistant arrow, it's going to be much harder to use. So make sure to get a Kuripe that has a bigger ratio between the two sides. The long side of the Kuripe does not need to go all the way into your nostril. There is no need to insert the Kuripe so far up. The problem with this is that most Kuripes are not going to fit you if you do this, and you'll likely blame the size of the Kuripe. The other problem is that if you're inserting the Kuripe too far up, you will be blocking the ability for air to move through when you blow the Hapé. It becomes like a plug, and your Hapé will likely not enter. So you need a small gap in the same nostril to allow for air to escape. This is especially important if your other nostril is slightly blocked or stuffed. This is the same science as opening a window in a car or in your home. Fresh air can come into a space that already occupies air if it has, no place to exit as well. So typically, to get the best fresh air coming in and out in a car or home is to open a window and open another window in another room. With a car, if you open the driver's window, it's best to open the passenger window or one of the back windows if you want airflow. So the same goes with your nostril in the Kuripe. You need space for air to move through the same nostril, especially if the other nostril is slightly blocked. So what I typically do is I place the Kuripe on the rim of my nostril, allowing a little space between the Kuripe and one side of my nostril. The placement of the Kuripe at your mouth is also very important. We're not putting the entire pipe in our mouth with our lips fully covering the pipe. We're pursing our lips to the Kuripe. This way the Kuripe fits right and you don't land up spitting in your Kuripe, but rather blowing air into it. If you place the entire Kuripe into your mouth, you will land up blowing and spitting inside. And you don't want this, as your spit will start clogging up the Kuripe and wet the Hapé. The way to insert a Kuripe is really, really important because this sets the angle up right. What you don't want to do is start at the mouth and then the nose for a few reasons. If you place it in your mouth first, and the Kuripe is still not in your nostril, and you decide to blow, you accidentally breathe out, you will land up blowing Hapé into your face. We want to start at the nostril first and then the mouth, but we also want the angle to be correct. So if the angle is not correct, what will happen is you'll be blowing Hapé straight up into your sinuses, and the Hapé will likely hit the back of your throat. You don't want this to happen. It's extremely uncomfortable and we try to avoid it. So you first place the Kuripe with the small side facing outwardly towards the edge of your face and the long side towards the middle. You'll insert the Kuripe into your nose, pull the nostril outward slightly, and then you turn the Kuripe inward so the small side touches your lips, and then you relax your arm. This is best to practice without the Hapé first so you can get a hang of the proper way to insert the Kuripe. You'll practice the same on the other side, making sure that the small side is facing towards the outside of your face and the long side is towards the middle. You'll insert the long side, you'll pull outwardly to create that space, and then turn the Kuripe inward so the small side is touching your lips. Once you do this, you now relax your hand. You make sure that the wrist is relaxed and your arm is down. If your wrist is up or your arm is up, you won't be able to get to the short side to meet your mouth, and you'll think something is wrong with the kuripe, but it's due to your technique. Remember, we don't want the short side in our mouths. We just want the edge of the pipe to touch our lips so we can purse our lips and blow without spitting inside of the kuripe. To create an even better space between the kuripe and our nostril, we'll talk about the angle. So now that we have an understanding on how to insert the kuripe properly, already establishing the right angle, we want to make sure that the angle is even more well positioned, so we don't blow Hapé straight up into our sinuses and we keep that gap. Hapé does not need to go up into our brains for it to work, which is why we don't put it all the way up. Hapé is absorbed through the inner lining of our nostrils, so our goal is to blow towards the inner or the outer wall of the nostril and not straight up. If you blow straight up, the Hapé will likely hit the back of your throat, especially if you have clear sinuses. So what we want to do here is we want to tilt the kuripe so that the opening is directed either towards the inner wall or the outer wall of our nostril, whatever feels more comfortable for you. This is the correct angle you want your kuripe in to avoid Hapé hitting the back of your throat. We are aiming to blow the Hapé towards the inner lining of our nostril and not straight into our sinuses. This way the Hapé can actually absorb through the inner lining instead of clogging up your sinuses. The most common reason you're getting hit at the back of your throat with Hapé is because the angle of your kuripe is straight up towards your brain instead of towards the inner lining or the outer lining. So the Hapé is moving straight up your nostril and landing in your throat. So remember to keep the kuripe angled. When the kuripe is angled correctly, it creates a small gap that allows for that airflow. When you are done with your Hapé session, the best way to clean out your kuripe is to simply blow through the short side with the long side facing away from your face. You are blowing the leftover Hapé into the air, returning it back to Pachamama, but make sure to close your eyes in case the angle is facing directly at you to avoid having Hapé blown into your eyes. You can also tip the pipe onto the palm of your hand and tap the kuripe until Hapé comes out onto your hand and rebottle it. However, I think for sanitation purposes and energetic purposes, it's best to simply just blow out the Hapé. You want to do this so your kuripe doesn't become blocked with leftover Hapé from each session. It's best to not put anything inside of your kuripe to clean it, like a Q-tip or something, as you'll more likely pack any Hapé that's inside, blocking the flow of air that's in your kuripe. It's much easier to just blow the remaining Hapé out. You also want to avoid putting any liquids inside, like rubbing alcohol or water, especially if your kuripe is made out of wood, as this will create a perfect habitat for bacteria inside and can also damage the wood of your kuripe. If you're sharing your kuripe with someone else, then you can spray a bit of rubbing alcohol or our smudge spray, which I'll link below, on the edges of the pipes of the kuripes and wipe it with a bit of toilet paper, but avoid getting the liquid inside of the actual pipe. This is how I typically clean it if it's going to be shared. I do recommend to clean your kuripe with smudge spray after every few uses, just to get the buildup of Hapé off on the outer edges of your kuripe. My biggest tips on picking out the right kuripe is to look for a kuripe that has an obvious difference in the length between the long and the short side. If they look around the same length, it'll be really hard to use. You want one with a more noticeable ratio difference. The angle between the long side and the short side, this angle matters, which is why the kuripes that I sell are customized angle and not standard. The standard angle is a little larger or wider and doesn't fit the majority of people, especially women and those with a small face, like mine. A large angle will pull your nostril outwards in front of your face, and this is really uncomfortable to use because we'll pull it out like that. So with that said, this is tricky and you won't know until you try. Our Kuripes are made to fit the majority of people, especially those with a smaller face. But if you know that you have a bigger face, you can find many Kuripes on Etsy. Something to note is the material as well. Our organization is big on eco-friendly materials and walking with a light footprint. We also place a very big emphasis on staying away from materials or ingredients that come from animals. Kuripes that are made out of bone are often not naturally found, but are hunted for purposes of profit. Consider that bone also has bacteria that you might not want blown into your body. Stay away from anything plastic too, as you will be administrating microplastics along with your hapé into your body. My biggest suggestions are wood and stainless steel. We use wood as it biodegrades with ease and returns back to nature. It's also the most cost-effective material. Note that if you follow these directions properly, most Kuripes will work. If you don't, you'll find that there are problems with your Kuripe when it's more likely your technique. Having said that, sometimes purchasing a Kuripe is trial and error until you find the one that feels most comfortable for you. So if you have any questions, please leave them below. And if this helps you get the angle right, then leave me a comment. I'd love to know. To deepen your experience with Hapé and for more teachings like this about how to sit with Hapé properly and sacredly, sign up to our online comprehensive Hapé course where we go through every aspect of Hapé and how to build a beautiful relationship with this heart-opening medicine. I'll leave the link below this video. And always, if you have any questions, please feel free to reach out. Until I see you in the next video, aho.